Absolutely. Let's get started.
Okay, well, everyone, thank you for joining the call. Senator Romney, this is Cameron Dill, the director of the League of Cities and Towns. And I want to thank you for taking a few minutes in Washington, and certainly a historic day here in Utah. I want all of the city and county leaders on the phone to know that over the last few days, Senator Romney and his staff have been in close contact with me, with League staff, with our policy director, Wayne Bradshaw, asking how they could be of assistance and offering this call. We were waiting for the final news on the financial support to come out of DC, and obviously there's big news on that today. But Senator, thank you very much for your leadership and outreach, and I will turn it over to you to give us an update on what's taking place on the federal level that impacts cities and towns.
Thank you so much. Appreciate that introduction and the chance to speak with mayors across the state. I understand we also have some county commissioners who've joined, if not visibly, at least telephonically. A couple of things. We're just early in the process right now, and understanding where this is going to go is going to take some time. In part because, as you all know, in the law they talk about the wheels of justice grinding slowly and finely. In Congress, the wheels grind even more slowly and probably not as finely. So we're in a setting right now where a lot of things are uncertain. Let me tell you the three major things that are going on. One, you heard that a bill was passed today. It was the House bill that had been agreed to by the White House, been negotiated by Secretary Mnuchin of Treasury with the House. Frankly, it's a pretty small bill, meaning it was dealing with things the way they were a week ago. And things are very different today. It was dealing with requiring employers to provide paid medical leave to individuals who need to stay home in quarantine for 2 weeks, as well as families that are individuals that need to stay home to take care of their kids or take care of someone that has COVID-19, which is all well and good, except a lot of people are being laid off. And getting paid medical leave is not going to help them if they don't have a job at all. And that's the reality this week. And who knows what the reality will be next week. So we're trying to, we're happy that we passed the bill. One thing that you're going to hear from small employers is they're going to say, wait a second, you're going to make it hard for me to meet my payroll because now I got to pay people if they're out on sick leave. It's going to make it even harder for me in these difficult times to survive. And in the next bill that we bring along, we're going to insist that companies don't have to meet the paid medical leave obligation until they get funding from the federal government that allows them to do so. So that is not yet law, but that's what we're working on, and hopefully that will be in the next piece of corrective legislation. The other major things that we're working on, three things, and they were spoken about by Secretary Mnuchin. They have not met with the Democrats, so we'll see whether they agree with them or not. But first is a payment to families. We've spoken about $1,000 per adult, $500 per child, a payment that would go out through the IRS for everybody who's been a taxpayer, to our veterans, Social Security beneficiaries, and so forth. So to go across to virtually all the citizens in our country. This would be to help stimulate the economy, but also to help them through what will be increasingly clear, difficult times for people in various businesses across our state. That's one piece that we're working on, and I'm on the task force of individuals that's responsible for that piece of legislation. There are 6 of us that are working on that. We have come to an agreement amongst the Republicans. The question is, can we get the Democrats on board, or will they want to change it in some way? And they may come up with an idea that is better or that's different, and we'll see where we end up. The second area relates to smaller business with 500 employees or less. And here is a different subcommittee headed by Marco Rubio. This little task force, and I'm actually a member of the committee, so I have input on this, but what this task force is looking at doing is having the Small Business Administration guarantee loans to all businesses that want them, that are 500 employees and less. The loans would be originated by banks, because banks are typically where Small Business Administration loans come from. So a small business would go to the bank and say, I want to borrow some money, and I want to use this money to pay my employees, to pay my rent, to pay utilities, to make payments on the fleet of vehicles we have, whatever the needs are of the business. They would get that loan from the bank. It would be 100% guaranteed by the Small Business Administration. So what's in it for the bank is they're going to get a fee for originating the loan and for servicing it. And then the expectation is that loan will be forgiven at the end of some period of time. It'll be forgiven for those businesses that frankly are able to get back on their feet, or those that maintain employment during this period of time. That provision, how it gets forgiven is uncertain, because we don't want to have people just coming and asking for free money from the government and never expecting to pay it back. But there is a recognition we've got to get money out to small businesses to allow them to pay their rent and pay the employees that they still have working with them. That's the second area. The third area relates to larger businesses, a much smaller number of businesses, but those that are critical to the national security and to the economic infrastructure of our country. And I'm talking about airlines, for instance, which is a recognition that airlines are basically flying almost empty these days. They can't go on like that very long, and we're going to need to get money to them. This task force is looking at the best way to do that. The current thinking is to make secured loans to those entities. In this case, the loans would be paid back, is the expectation. And so those are the three major efforts that are underway. Again, we're at an early stage here. The House just passed their first bill on Monday and sent it over to us. We just passed it today. So it only took 2 days. We got it passed. But now we're dealing with these other three priorities, and they will surely take at least a week or two for us to be able to work through. So don't expect the checks coming to individuals in the next week or two. It's going to take longer than that. One, to get the legislation passed, and two, to get the IRS to figure out how to cut the checks and get the checks out to people. Likewise on the small business loans, it's going to take a while before we can get the SBA to get the paperwork out to all of the banks to tell them how to originate the loans, what the fees are going to be, the processing fees, the origination fees, and so forth. So it's going to take a little while here, but I do believe that help is coming. You should know that the sense among my colleagues on both sides of the aisle is this is not a time for us to be pinching pennies, that the economy is really struggling given this coronavirus challenge, this crisis, and that this is the time when you borrow money and anticipate paying it back at a time when the economy is stronger. I'm one of those that's very unhappy with the fact that we've been borrowing money even with a strong economy of roughly $1 trillion a year. That, I think, was a big mistake. But at this stage, not borrowing money, in my opinion, would be an even bigger mistake. So I, among many others, am willing to borrow what's necessary to keep our small businesses intact, to make sure they can make their payments, their rent payments, and so forth. I'll note one more thing, and that is my committee is dealing with various measures that would reduce the cash flow burden on small and large businesses and individuals by, for instance, saying that your taxes that normally would come due on April 15th, you wouldn't have to pay until some substantial period later, 90 days later or 180 days later. You'd be able to keep that money, wouldn't have to make the payment. You'd ultimately make it, but you wouldn't have to pay it until later. That allows businesses and individuals to keep cash. And there'd be no penalty or interest charge for individuals making the payments a little later. I've also received from you guys a group of 10 questions. And frankly, I don't have the answers to all these because in many cases, we have not dealt with the issues facing municipalities across our state or across the country. We're right now focused on those three big priorities I described to you at the outset. But on those that I can answer, let me do that as best I can. The first question comes from Mayor Dolly in Holiday. He asked about the economic tidal wave and what we're doing, and I think what I've already said responds to that question as effectively as possible. The second question is about temporary medical eligibility for wage earners who no longer have a paying job. We're going to get back to you on that. That's coming from the League of Cities and Towns, and I don't have a great answer for that yet. So we'll get back to you on that. The third question is, what assurances will we have that small cities who would be decimated by federal and state decisions are not going to be left behind in the stimulus packages and emergency funding? This comes from Cheryl Bowers. She's a Blanding City Council member. And the truth is, I don't have assurances for you on that. We haven't begun to deal with help to cities and towns. My expectation is it's going to be a while before we get to that. We're getting questions also about tribes and how we're going to help tribal members. Again, we're right now trying to figure out how we're going to deal with those first three priorities I described. So I don't have good news for you on whether there's going to be relief in some way coming to cities and towns. I would make expectations that there will be. I think the state is probably where most folks are going to think cities and towns need to turn. And if there's going to be help that comes from the federal government, it'll come to the state and then on from the state to you. The fourth question, what is the status of federal aid for small business, and how best do we direct local businesses to get federal aid? And again, that comes from the League of Cities and Towns. I think I've answered that as well as I can at this point, which is that Marco Rubio's task force is saying that small businesses will be able to go to banks where they typically have relationships, get a small business loan. It will be 100% guaranteed by the federal government. And in many cases, perhaps most cases, there will not be a need to repay it. It will be forgiven. But what the terms are for forgiveness have not been worked out yet. We're not going to say basically just go get some free money and you don't have to pay it back. Why, we have a line going around the whole country. But where businesses are in trouble because of this virus crisis, getting money to them is our priority, and we don't want to saddle them up with debt that they can't service down the road. So how to deal with this particular issue is uncertain at this point. But they can't get the money yet because it hasn't passed Congress yet, and it's going to be a few weeks before we're able to get that out. And I know you want it fast, and we recognize that. Number 5, the question that comes from Rainey Daraseri of Moab. She's a council member there, city council member, talking about the shortage of critical medical equipment and what can the federal government do about that. We do have a national strategic stockpile of devices, of protective equipment, and various medically suitable devices, and masks, protective equipment, and so forth. And state departments of public health are the ones to talk to about getting access to that strategic stockpile. I can't tell you how much is in the stockpile, but I do know that it's woefully inadequate for our national need. When we began this crisis, when we began thinking about it in a serious way, when we saw the numbers coming from China, I asked the people at the CDC, how many masks do we have and how many gowns do we have for medical workers as a percentage of what we'll need? And they said, well, we have about 10% in the strategic stockpile of what we need. So while that's the place to turn to see if there's something that could be helpful, I can tell you that it's not a stockpile that's very encouraging. Now, on the positive side, there's a major effort that's been undertaken to get American businesses to start making masks and gowns, eyewear, and so forth. And that is underway. How advanced that is at this stage, I don't know. And we'll get you that information as soon as we can. But again, your State Department of Public Health is where that information is being communicated today. One question, will there be, this comes from, again, the League of Cities and Towns, will there be any federal effort to address employers' increased premiums due to the unemployment insurance claim increase? I don't have a specific response to that because we haven't discussed that yet. But my expectation is that of two things. One, there is talk, particularly on the Democrat side, but it's something that Senator Lindsey Graham and I are also pushing, which is that we should increase the amount of money that comes through unemployment insurance. And that in the case that we do so, that would not lead to an increase in unemployment insurance rates. Our desire is not to charge people more money. Our desire is to get money out to people who need help, and not to put a bigger burden on our businesses. So while this hasn't been dealt with yet, we're aware of it, and we're trying to get more money into unemployment insurance so people are more close to being able to meet all of their personal obligations. Seventh question, which comes from Carrie Malkovich from Woodland Hills, a city council member there. She said, residents are currently receiving Medicare benefits, are required to utilize authorized providers and facilities. And the question is, can they use some other facilities? The answer is that today, because of the president's declaration of national emergency, CMS has activated blanket waivers, and these waivers allow CMS to take a lot of actions. One is to provide waivers and flexibilities for hospitals and other health providers, other health facilities. Second is to provide enrollment flexibilities for individuals. Third is to provide relief and flexibility for state Medicaid agencies. And number 4 is to suspend enforcement activities. So all those things are being contemplated by CMS. So I think there is help coming on that front. I'd like to be more definitive, but again, we just had the emergency declaration today. CMS is being given greater flexibility in those 4 areas. How they will choose to execute that is being determined at this point. Number 9 was, is there an update on any efforts to acquire the chemical necessary to complete COVID-19 testing? The answer on that is the administration is looking for ways to get additional chemicals to provide tests. I can tell you that there is a company in Utah that has not just the reagents, but has a test. It believes it can do 50,000 tests a week. So we're very encouraged about our state's capacity to dramatically increase the number of tests. There is a full-blown effort on the part of the administration to get more testing out there. But the reality is it's been way too slow coming. It's been very frustrating that we saw what was happening in China and in South Korea and Italy, and we were not pedal to the metal authorizing research institutions to develop their own tests, getting our own reagents in place. A lot of the reagents are coming from other countries, so we have limited supply, but there is a full-scale effort on the part of the administration to try and correct for this, I think this failing that frankly, Dr. Fauci, you've heard him time and time again, Anthony Fauci has spoken about the failing that we had in getting testing out. And until we have a lot of tests out, we just won't know how many people have this, this illness. I have one more question, and that is, there are some rumblings about delaying the federal income tax filing deadline. What's the status of that? I didn't mention that up front, which is that we do have, I think, a growing consensus that that will happen, in part because it does not require congressional approval. That's something the Treasury Department can do on its own. And Secretary Mnuchin said that it is his expectation that they will be saying to individuals whose tax obligation is $1 million or less, or to corporations whose tax liability is $10 million or less, that they don't need to make the payment on April 15th. They need to file on April 15th, but they don't need to make the payment until 90 days later. Some of us are arguing that we should push that to 180 days later, but we'll see if we're successful in that, but at least till 90 days later. And there would be no penalty or interest charge for making the payment 90 days later. So that's an update on the questions you sent. I'll add just 2 more things. One is a personal observation that may be inaccurate. So, as a lot of my personal observations may be inaccurate, but this one in particular. I'm looking at the data that's coming out of Italy and South Korea, and it looks like the people who are getting most ill and require treatment in the ICU and those that die are overwhelmingly, I mean 98 or 99%, older people or people with underlying medical conditions of some significance, compromised medically. And what that suggests to me is that those individuals, those of us who are over 65 or over 70, should take really extreme precaution to keep from getting this this COVID-19 virus. And for some people, that means they're going to stay in their own home, and other people will bring groceries to them. For others, they're in the same home, perhaps with their kids or grandkids. They're going to put a dividing line up and say, hey, don't you come within 6 feet of that dividing line. You can provide me my meals, but you stay on that side and I'm going to stay on this side. But it means extra vigilant effort on the part of those who are immunocompromised, who have underlying health conditions like diabetes or high blood pressure, people who are taking immunosuppressants. These individuals, as well as older folks, would be wise to take special care and precaution. Among younger people, I'm not saying you don't need to take all that care and precaution, but what we're seeing from the data that's currently coming from overseas is that younger people, when they get this sickness, are more likely to experience flu-like symptoms, or perhaps no symptoms at all. And the risk to them is not so great to them personally as it is a risk that they might carry it to someone who's older or immunosuppressed, who then could die. So we're asking people to be careful, particularly over these next couple of weeks. But I think longer term, we got to think about younger people going back to work, getting back re-engaged in the economy. That's something we're thinking about. Again, that's my own view. I'm not a epidemiologist, or however you pronounce that word, but I think it bears close attention to that information. Finally, I'd say this: you are essential workers, and I may be in the same category as an essential worker. We all think of healthcare personnel being essential workers, and firefighters and police, and they are. But so are people like you that are serving the public and doing things that have to be done in order for normalcy to exist, for people to get information that they need, and for people to have confidence so that they don't become fearful and panicked. And I appreciate your willingness to serve me and my community where I live in Utah, but people across our entire state. And I want to say thank you for your willingness to serve, despite the fact that it does present an additional risk, particularly for those of us that are older. And I appreciate it. And I think the people of our state are going to appreciate it as time goes on, and applaud you for the service you're providing, which I think is very much merited. So with that, we'll turn back to any goodbye that you may have.
Thank you, Senator, and thank you for taking the time to address all the questions that we received. For those who are on the call, we will still continue to take questions to share with the Senator and with his staff. So even if we don't have another call scheduled for the next few days, we'll continue to make sure that questions are getting to his office and answers are getting back to you. So Senator Romney, thank you very much for taking the time to chat with over 150 mayors, council members, county commissioners, and city and county staffers.
Thanks so much. Good to be with you, and wish you all the best. And let's hope we don't have any more earthquakes. Good night.
Thank you, Senator. Good night, everyone.